Hello, everyone. Today, I would like to explain the nursing tree of knowledge or the nursing knowledge tree. I adapted this teaching analogy shared to me by Dr. Kenya Beard during a professional development day in about May of 2026. But the graphic is pretty much a clear graphic from me, but it was really um, introduced to me by Kenya Beard, which was very insightful for me, and I truly enjoyed her lecture. So I just wanted to help you guys understand that when you build your knowledge, why is it important? Why how you study matters is so important because nursing is not about memorizing diseases. It's about understanding concepts. Every disease process is built on a few nursing concepts or a few core concepts. Strong foundational knowledge leads to stronger clinical judgment. So you can't just jump straight to the complex diseases. You have to start from your foundation and build from there. So all those lecture classes that you've taken before, you can't just say, "Oh, I'm over it now." You have to build on them in order to get to where you need to be for your patients. But these are our main stems. It's not all of them, but this is just an example of what you need to know to understand why these all apply. Think of your nursing education like climbing a tree. The diseases are the fruit at the top, but you can't reach them without first building a strong trunk and strong roots. If you try to memorize diseases without understanding the underlying concepts, you'll eventually struggle. My goal is to help you become a nurse who understands why something is happening, not just what is happening. If you are ever a student of mine, you always know that I will always ask you why. I know that therapeutic communication, we are not supposed to say why, but I always want you to explain what is the rationale. Any student that's ever been with me will always tell you I'm always asking why. I want to ask you why because the patients will ask you why. Sometimes if you do something, your coworkers will ask you why. The doctor will ask you why. You will have to have a knowledge base to explain the reason why you do what you do. We are not robots. One of the biggest mistakes nursing students make is trying to memorize every disease. Instead, start with the trunk, not the branches. The trunk represents the core nursing concepts like acid-base balance, shock, fluid and electrolyte balance, oxygenation, perfusion, and level of consciousness. Another main example, you know how I like to talk about the RAS system, inflammatory process. Those all fall into other key concepts in patient care. Once you truly understand these concepts, diseases like stroke, heart failure, COPD, diabetes, and sepsis becomes much easier to understand because they're all built on the same foundation. Don't study hundreds of diseases separately. Master the concepts first, and you'll develop the clinical judgment needed for the NCLEX and patient safety. As nurses, we need to become fluent in three languages. First is medical language, understanding the terminology physicians and other healthcare providers use so we can collaborate effectively and communicate accurately. Second is nursing language, translating the information into assessment, priorities, clinical judgment, and nursing interventions. And finally, we also have to speak to the patients and their family by explaining the complex medical conditions in simple, understandable terms. Patients and families depend on us to answer their questions and clarify um, any misunderstandings. We have to answer these questions with clarity and compassion. Great nurses know all three languages and move seamlessly between them to improve teamwork, build trust, and provide safe, patient-centered care. The Feynman technique is one of the most effective ways to study nursing because it focuses on understanding rather than memorization. First, choose a concept like metabolic acidosis or heart failure. Next, explain it as if you're teaching a patient or someone with no medical background. Most likely, you're going to actually explain this to your family members, maybe family members who do not have a medical background. If you can't explain it clearly to them, you found a gap in your knowledge. Go back, review the material, and simplify your explanation. If you can teach it in plain language, you'll be better prepared to collaborate with healthcare providers, educate patients, and apply your knowledge safely in clinical practice. Successful nurses don't memorize. Have you been hearing that? They think critically. Instead of asking, what disease is this? Start asking, what concept is affected? Then identify the assessment findings, understand what's happening physiologically, anticipate possible complications, and determine your priority nursing interventions. For example, don't just memorize pneumonia. Think about oxygenation, perfusion, infection, acid-base balance, and patient education. When you learn to think in concepts rather than diseases, you'll better be prepared for NCLEX, collaborate more effectively with healthcare team members, and most importantly, provide safe evidence-based practice care. So, as you grow into this nursing journey, your patients need, remember that your role is much more than carrying out provider orders. Nurses are patient advocates, critical thinkers, an essential part of the healthcare team. We collaborate closely with physicians and other professionals, but we also serve as an important system of checks and balances. Recognizing changes in a patient's condition. Like, let's say a doctor was to tell you to give a patient's ampicillin, but the patient tells you they're allergic to amoxicillin. You would have to recognize these changes. You would have to recognize that that doesn't sound right. You ask questions when something doesn't seem right, and you speak up to keep our patients safe. The knowledge you gain in the classroom, combined with hands-on learning and simulation and clinical experiences, will strengthen your clinical judgment, build your confidence, and prepare you to be a great provider and provide safe, compassionate, evidence-based care. So please, if you have any questions, never be afraid to ask. If you're seeking clarity, don't wait till the last minute. Try to lecture yourself or try to prepare for lecture before the lecture so that you don't feel lost because we go fast. There's a lot of information for you to know, but what are the key concepts that you need to understand? What is the trend that you would need to understand when taking care of this patient? I really hope that this helps. I really hope that this helps you understand how to move forward in the nursing program. Um, Thank you for listening.